On March 11, 2020, Guyana recorded its first COVID-19 case and death. For the last 3 years, Guyana has grappled with the novel coronavirus, implementing new measures to control the spread of the virus and how people were infected. On Monday, after months of lobbying, new COVID-19 treatment pills, the paxlovid pills developed by Pfizer Inc., were added to Guyana's arsenal to fight the deadly disease. They were donated by the local United Nations Children's Fund office.
Generally, because of the high cost and also high demand, it was not accessible to lower and middle income countries. But UNICEF, through our partners, we make sure that all these countries are accessible, have access to these medicines, including Ghana. So finally, today we are here to hand over the 5,040 boxes of paxlovid, which includes 151,200 pills to treat 5,040 patients in Guyana.
Guyana's Health Minister Dr. Frank Anthony said these pills will be distributed across the country and will boost healthcare.
How these medications work, it's really an antiviral medication, and as you know, SARS-CoV-2 is a virus. And so at critical points in the life cycle of the virus, it would interrupt that life cycle, and by doing so, prevent the virus from replicating. And it has been quite effective in doing so. So most people who use this medication actually saw a reduction in the time that they spent, and even if they were very symptomatic, you would see that change quite rapidly.
Importantly, though, these pills have been secured at a time when Dr. Anthony believes the COVID-19 threat has been well managed.
Right now, we are not seeing a lot of cases. In fact, we have 13 active cases right now. And over the weekend, we recorded 3 new cases. So it's at the lowest level that we have seen so far. And Dr. Boville will probably tell us there are almost no patient at the hospital. So that's a very positive thing. And we want to keep it that way, but just in case we have patients, we now have medication that we can use for those patients.
With the paxlovid pills, Dr. Anthony believes that Guyana's efforts at managing the disease will continuously improve. Reporting for the newsroom, I am Vishani Raghaber.